Today, we're delving into a significant health issue that can affect our canine friends who are battling lymphoma, a condition known as hypercalcemia of malignancy, which means high calcium levels in the blood caused by the cancer. This can sometimes lead to a serious complication involving the kidneys called azotemia, where waste products build up in the blood. A recent study has taken a close look at how these issues play out in dogs with lymphoma and what the outcomes might be. The study we're exploring today comes from researchers at The Ohio State University College of Veterinary Medicine. Their work, titled Evaluation of the Clinical Outcome of Hypercalcemia of Malignancy and Concurrent Azotemia in Dogs with Lymphoma, addresses an important concern in veterinary oncology. As the authors point out, hypercalcemia of malignancy that develops because of lymphoma in dogs has the potential to damage the kidneys. Despite this potential for harm, there hasn't been a lot of detailed information available about the long-term effects on dogs who experience both high calcium levels and kidney issues at the same time as their lymphoma diagnosis. The researchers in this study set out to better understand what happens to dogs with lymphoma who develop acute kidney injury as a result of hypercalcemia of malignancy. Specifically, they wanted to see if these dogs were more likely to suffer severe kidney damage or if treatment could help resolve these complications. Their main idea, or hypothesis, was that dogs do experience acute kidney injury when they have hypercalcemia of malignancy, but that they might not necessarily die from kidney failure because of it, regardless of how severe the high calcium or kidney issues were when the lymphoma was first diagnosed or if it came back. To investigate this, the researchers conducted a retrospective study. This means they looked back at the medical records of dogs that had already been treated. They identified 29 dogs that had been diagnosed with lymphoma, had high calcium levels in their blood, and also had azotemia that was classified as grade 2 or higher according to the International Renal Interest Society, which is a way veterinarians categorize the severity of kidney problems. All of these dogs had received chemotherapy as part of their treatment. The study was conducted across 2 different veterinary hospitals, The Ohio State University and the University of Minnesota. The researchers gathered a lot of information from these medical records, including details about the dogs' breeds, ages, the type and stage of their lymphoma, what treatments they received, and how their calcium and kidney levels changed over time. They also looked at whether the dogs were hospitalized, if their hypercalcemia or azotemia resolved, if their lymphoma went into remission or came back, how long they lived, and what ultimately caused their death. Now, let's delve into what the researchers discovered. First, they found that after the dogs began treatment, both the high calcium levels and the azotemia improved in most cases. In fact, the hypercalcemia resolved completely in all 29 dogs. The time it took for the calcium levels to return to normal varied, ranging from just a few days to over 2 months, but nearly half of the dogs saw their calcium levels normalize within the first week of treatment. The news was also encouraging for the kidney issues. Azotemia resolved in nearly 80% of the dogs. The time it took for the azotemia to resolve also varied quite a bit, from less than a week to almost a year. However, it's important to note that in the remaining 6 dogs, while their kidney injury grade improved, their azotemia did not completely go away. The researchers also looked for factors that might predict whether a dog's azotemia would resolve. They found that the concentration of creatinine in the blood and the total calcium level at the time of diagnosis were significant factors. Specifically, they found that for every unit increase in serum creatinine, the likelihood of the azotemia resolving decreased significantly. Similarly, higher total calcium levels at diagnosis were also associated with a lower chance of the azotemia resolving. Other factors like blood urea nitrogen levels, the initial severity grade of the kidney injury, the dog sex, and whether or not they were hospitalized did not appear to be significant in predicting the resolution of azotemia. To further explore the relationship between calcium and creatinine levels and the resolution of azotemia, the researchers performed what's called ROC analysis. This helped them identify potential cutoff points for these blood values that might help predict outcomes. They found that a total calcium level of 17.5 milligrams per deciliter or higher was very good at identifying dogs whose azotemia would resolve, although it wasn't as specific. They also found that a creatinine level of 3.0 milligrams per deciliter or higher was very good at predicting which dog's azotemia would not resolve. The study also tracked what happened to the dogs over time. They found that the most common reason for death was the progression of the lymphoma. Interestingly, death directly caused by kidney failure appeared to be infrequent, occurring in only 4 out of the 26 dogs for which the cause of death was known. In 2 of these 4 dogs, the lymphoma was also getting worse at the time of death. One dog died from a blood clot related to a protein-losing kidney condition, but this dog was actually in remission from lymphoma based on necropsy results. The final dog died of kidney disease at an unknown time, but was also in lymphoma remission at the last checkup. Of these 4 dogs that died due to kidney issues, 3 had not shown a resolution of their azotemia that was present at the initial diagnosis. The researchers also looked at whether there were any visible changes in the kidneys on ultrasound at the time of diagnosis. They found that some dogs did have abnormal findings, such as a medullary rim sign, which is a specific pattern seen on ultrasound, or mineral deposits in the kidney. However, they did not find a significant link between these ultrasound changes and death related to kidney disease. Regarding the return of hypercalcemia when the lymphoma relapsed, the researchers found that it didn't happen in the majority of cases that were reassessed. Similarly, a return or worsening of azotemia at the time of lymphoma progression was also uncommon. In the discussion of their findings, the researchers highlighted that their study seems to be the first to really look at the long-term outcomes in a group of dogs with intermediate to high-grade lymphoma that had both hypercalcemia of malignancy and azotemia and were treated for their cancer. They pointed out that previous studies had sometimes linked hypercalcemia with other negative signs in dogs with lymphoma, like a specific type of lymphoma called T-cell lymphoma, but it wasn't always found to be an independent predictor of a poor outcome. The study authors also discussed the complex ways in which high calcium levels can lead to kidney damage. These include things like reduced blood flow to the kidneys, impaired response to a hormone that helps regulate water balance, direct damage to the kidney tubules, and dehydration. They noted that while kidney problems are known to occur in dogs with cancer and high calcium, the specific details and outcomes, especially in dogs with lymphoma, haven't been very well documented. The fact that all dogs in this study had what's called substage B lymphoma, meaning they showed general signs of illness, is also important to consider. The researchers explained that in humans with lymphoma, specific B symptoms are used to describe illness related to the cancer, whereas in dogs, substage B can include any clinical sign, which might or might not be directly due to the lymphoma. This makes it potentially harder to understand the impact of the hypercalcemia and azotemia on the overall outcome in these dogs. The finding that higher initial creatinine and total calcium levels were linked to a lower likelihood of azotemia resolution is clinically significant. The researchers suggest that a higher creatinine level might indicate more actual kidney damage, rather than just a temporary issue due to dehydration. Similarly, the reason why higher calcium levels might hinder kidney recovery isn't entirely clear, but could be an important factor for veterinarians to consider when assessing the prognosis for these patients. The researchers also addressed some limitations of their study. Because it was a retrospective study, they had to rely on the information available in the medical records, and they didn't have access to lab results from before the dogs developed lymphoma, hypercalcemia, and azotemia. This means they couldn't always tell if there was pre-existing kidney disease that might have influenced the outcomes. Additionally, it was sometimes difficult to fully assess the dog's hydration status from the records, which could have helped differentiate between temporary kidney issues due to dehydration and more significant kidney damage. Another limitation was that very few of the dogs had a necropsy performed, and kidney biopsies were not done in any of them. The researchers suggest that future studies that include these types of detailed examinations of the kidneys could provide even more insight into why azotemia might not resolve in some dogs and what long-term changes might occur in the kidneys. Despite these limitations, this study provides valuable information for veterinarians treating dogs with lymphoma who develop hypercalcemia and azotemia. The reassuring finding is that while these complications are serious and require treatment, death directly from kidney failure appears to be uncommon in this group of dogs. The resolution of hypercalcemia was achieved in all cases, and azotemia resolved in the majority. The initial levels of creatinine and calcium seem to be important indicators of whether the kidney issues will fully resolve. Further research will continue to build on these findings and hopefully lead to even better ways to manage these complex cases.